Hi, I'm Dr. Dave. I'm an avatar, but I'm based on a real person. This means I'm a virtual person created by doctors and researchers who've helped a lot of suicidal patients over the years. I'm a member of your care team, and some people feel more comfortable talking to me first because I have all the time in the world and I'll never judge you. Because I'm a virtual person, I may not always understand what you're saying, but I'll always check with you to make sure that I got what you said right. You'll have a chance to correct yourself as we go and at the end of our conversation. I think I can be helpful to you. As an avatar, there are a few things that we can do together in advance of meeting with your doctors and nurses. I can help you collect your thoughts, get focused, sort through what you're going through. Don't worry, whether you choose to work with me or not, you'll still get to talk to your doctors and nurses so they can help you. One of the most important things I can do with you is to hear your story, what you've gone through and what brings you here, and what's led you to this dark place. Now, when I say I want to hear your story, what I mean is I want to understand the experience of what you're going through. To that end, there's a structured interview I can do with you that helps me understand what it's like to be you right now. Sometimes when people are in crisis and suicidal, they can really feel alone. And I want you to know that you're not alone. Another thing I can offer is the chance to watch videos of people who've gone through difficult times too. They've been suicidal, they sought treatment, they've come out the other side, and now they're making contributions by helping people who've gone through these experiences. Just so you know, you can choose to watch these videos before or after you tell your story. It might help you in describing your experience. I'm going to ask you a series of questions relevant to suicidal risk. For example, can you please describe to me and rate your psychological pain from 1 being very low pain to 5 being very high pain? How would you rate that, 1 to 5? A 5, I see that's really high. And then, can you describe in your own words what you find most painful? All right, this is what I understood to be causing you the most emotional pain. Did I get that right? Next, I'd like for you to rate your stress, the stress that you're going through, from very low stress, 1, to 5 being very high stress. So 4, pretty high, and then describe in your own words what you find most stressful. Now this is what I understand to be causing you the most stress. Did I get it right? Next, I'd like to know about your agitation, or your sense of emotional urgency. Would you rate your agitation as low, 1, or very high, 5? Pick a number between 1 and 5. So 4, pretty high. And then describe to me what you know about when you most need to take action. Okay, so this is what I understood to be causing you agitation. Did I get it right? Now, can you please rate your hopelessness from 1 being very low hopelessness to 5 being very high hopelessness? I see, it's a 3, right in the middle. And then describe to me, what are you most hopeless about? Okay, so this is what I understand to be causing you to be hopeless. Did I get that right? Next, we know that many suicidal people are very unhappy with themselves. I'd like for you to rate your sense of self-hatred from 1, very low self-hate, to 5, very high self-hate. So 4, pretty high. And then, what do you hate most about yourself? Now, this is what I understand to be causing your self-hate. Did I get that right? Finally, I'd like to rate your overall risk of suicide from 1, extremely low risk, in other words, that you will not kill yourself, to 5, extremely high risk, that you do think you will kill yourself. How would you rate yourself from 1 to 5? A 5, I see, that's really high. Next, how much is being suicidal about you? Not at all, 1, to 5, completely. A 5, I see, that's really high. Alternatively, is being suicidal about other people or your relationships? From 1, not at all, to 5, completely. Okay, a 1, not so much. Now, I'd like for you to rate your wish to live, 0 to 8, 0 being not at all, to 8, very much. And how about your wish to die, from 0, not at all, to 8, very much. And finally, as you think about the state that you're in and how you're feeling, is there one thing that could change that would take suicide off the table? What's the one thing that would make you no longer suicidal? Can you please describe that for me? Thanks for completing this assessment. It really helps us help you. In the next screen, I'll summarize the information you've just shared with me. You can review it, edit it, change it as you see fit, and what you want to share with your provider. And come back anytime if you want to talk, or we can do an activity to help you feel better. In any case, I'll be here for you.